After super extremity and inferior extremity, today we are going to see the important topics in the abdomen and the pelvis. So, in that will be the LQs which will going to come in our anatomy exams. So, let's start. So, we are going towards the introduction astrology. In this astrology, there is a one bone that is bony pelvis. So, this bone will come to in your viva. So, you have to do this very point to point. They will definitely ask the difference between the male and female pelvis as well. So sex determination of pelvis will be the important point, right? After this, in the next chapter is anterior abdominal wall. In this chapter, you are going to do the, let's see, I think in this chapter there is a one thing that is the inguinal ligament. So you have to just do the its attachment and relations. It is not so important, but it may sometime maybe they will ask you. That is the inguinal ligament. After the inguinal ligament, there is a next chapter or next thing, that is inguinal canal. This question may come in our midterm or the prelim exam for the 10 marks question. So you have to do definition, boundaries, relation, structure related to it, mechanism of inguinal canal as well as development. As indirect डायरेक्ट हरने के बारे में आपको सब कुछ आना होगा, क्योंकि क्वेश्चन 100% आएगा आपके क्लिनिकल क्वेश्चन में 5 मार्क के लिए आ सकता है. सो प्लीज डू द इंग्वाइनल हर्निया का clinical things. After this chapter, we are going. Next chapter is male external genital organs. In this chapter, there is I think there is not, this chapter is not so important because, but there is one thing that is the this thing is hydrocele. So hydrocele will come in our 2 mark question in our exam for the 2 mark question. So we have to do this hydrocele. After this, there is a question like undescended testis or cryptorchidism will may ask, they may ask, right? सो गाइज, आपने अभी तक मैंने जो क्वेश्चन बताए आपको किसी भी सीनियर से पूछें और आपको 100% बताएंगे यही क्वेश्चन आएंगे. और मैं आपको 100% गारंटी के साथ बोल रहा हूँ कि क्वेश्चन आपको एग्जाम में 100% आएंगे. सो बिलीव मी, प्लीज डू रीड दिस थिंग्स, यू विल गेट डेफिनेटली गुड मार्क्स इन योर नेक्स्ट एग्जाम्स. मैं अभी आगे बढ़ता हूँ. सो देयर इज अ questions, or there is a one short note type of question, that is a mesentery. This may come to you in the short note question. So you have to do the mesentery, its borders, its distribution, and also the contents of the mesentery. You have to do this diagram, right? So after this, this chapter is complete, I guess. Then the next chapter is the abdominal part of esophagus and the stomach. So in this chapter you have to do this chapter is not so important. In small intestine, there is definitely one question, that is the duodenum. They will ask duodenum for the 10 mark question. You have to do it all the parts of the duodenum, right? First part, second part, third part, their course, relation, fourth part, and the contents, and what are they related to. The arteries are venous, lymphatic drainage, आपको सब पता ही होगा, right? That is the duodenum of that question. Then the next thing is we are going forward, right? Then this diagram, you are looking at this diagram, that is the position of appendix. This diagram is important because from this diagram they will ask you some MCQs. They may ask you some short answer question for 2 marks, right? So this may come. After this, as I go forward, so this diagram is also important because this diagram is showing the arteries of the selector that supplies the stomach. So they may ask you which arteries are supplying the stomach. So this diagram is important. You have to understand this diagram or memorize this diagram, or you have to know the arteries supplying the stomach, right? After this, I'm going forward. Then in this chapter, I think on spleen. So in the next LQ will they may ask you, that is the spleen. This is 10 mark question. So आपको पता होगा 10 mark question का मतलब क्या है. आपको 3-4 डायग्राम बनानी है, सब कुछ लिखना है जो भी आपको पता है, और एक पैटर्न के तरह से लिखना है, और एट द एंड आपको क्लिनिकल एनाटॉमी के साथ इसको एंड करना है, राइट? देन द नेक्स्ट क्वेश्चन विल बी ओके. सो नेक्स्ट क्वेश्चन इज द लीवर. सो आपको अभी समझ आएगा कि इस चैप्टर में आपको 2 LQ मिलकर, डेट स्प्लीन एंड द लीवर, राइट? सो स्प्लीन लीवर के बारे में आपको ऑल द मोस्ट ऑफ द थिंग्स आपको याद करनी पड़ेगी या फिर आपको ध्यान में रखना होगा कि क्या क्या इसका रिलेशन, सप्लाई, बाउंड्रीज ये सब है, राइट। देन kidney as a elective, right? After the kidney, diaphragm is the chapter. In the chapter, I think not so important, but they will ask you the things that passing through at which vertebral level from the diaphragm in the Viva as well as in the theory exam. So you should know that what passes through the level up to T8, T10, T12, right? So there is a mnemonic, vagina over anus. You may be laughing at it, but it's the easy for me to remember. So vagina over anus is the mnemonic for the things that are passing through the diaphragm in the order. Then as I go forward, I think end of the things from the abdomen, I guess. Now I may directly go towards the there is in the pelvis region there is a one elective, that is the urinary bladder. This will come you as a, आपको ध्यान में रखना है कि पेल्विस से एक यही क्वेश्चन है, दैट इज यूरिनरी ब्लैडर, एंड यही क्वेश्चन आपको आएगा, आता रहेगा, प्रीलिम्स में आएगा, मिड टर्म में आएगा और फाइनल में भी आएगा, दैट इज यूरिनरी ब्लैडर, क्योंकि दिस इज द ओनली वन क्वेश्चन दैट दे विल आस्क फ्रॉम द पेल्विस, एंड फ्रॉम द पेल्विस दे हैव टू आस्क वन एलक्यू. सो ब्लैडर आपको लाइक 110% करना है, ब्लैडर फॉर द एलक्यू, राइट. सो फीमेल रिप्रोडक्टिव ऑर्गन्स दैट नॉट सो इम्पोर्टेंट for the exam point of view. Okay, then men external organs, internal organs are not so important. Rectum, I think this end of this chapter is end of the pelvic and the abdomen things for you guys. Barium, enema, the barium studies. So they will ask you barium swallow, one question, right? They will ask you barium enema, 2 question. They will ask you pylography, 3rd question, and they will ask you the types of the pylography, that is extraordinary pylography and the retrograde pylography. So these are the 4 questions that they will ask you from the radiology part, right? Yes. So this is all about abdomen and the pelvis questions that are important for you for the prelims, midterm and the final exams. So guys, best of luck for your next exams. एब्डोमेन एंड क्लियर आपको हो गया होगा कि क्या क्या क्वेश्चन आएंगे. मैंने अपर एक्सट्रीमिटी के बारे में बताया एंड लोअर एक्सट्रीमिटी के बारे में बताया. अब मैंने एब्डोमेन एंड पेल्विस कवर किया है. द नेक्स्ट वीडियो विल बी ऑन द what's that, the neuroanatomy. After that, anatomy chapter will be complete. If you guys want important questions from the histology and embryology, please let me know. I will there to help you. And I think after this the neuroanatomy video, I will be done with the important questions that they will help you, I guess.